Hey guys, welcome back to my YouTube channel. It's Call Me Bell. Are you a nursing student? Are you planning on becoming a nursing student? Are you thinking about becoming a nursing student? Are you skeptical if you should be a nursing student or not? So I think this video is for you. I'm gonna be talking about what you should know before you become a nursing student, or the things you should expect while in nursing school. So nursing school is hard, no doubt about it, but is it doable? Absolutely yes, it is 100% doable, because that's what I told myself, that if everyone is passing, if everyone is making it, if everyone is becoming a nurse and I want to become a nurse, though it's hard, of course I can do it. So first of all, I'm going to say congratulations on thinking about becoming a nurse, or on deciding about becoming a nurse. Nursing is an amazing career. It's a great profession, and I think those that are nurses should be caring, they should be compassionate, they should they are advocates for their patients, they should love their patient, they should care for their patient, they should put their patient first while at work. But when you go home, please take care of yourself. So with nursing school, first of all, I'm gonna say you should plan. You should be a good planner if you are in nursing school. And if you're planning to become in a nursing school, you need to talk to family members, you need to talk to your friends, you need to talk to loved ones, and tell them what you're trying to do, so they can be a good support system to you. Because if you want to become a nurse and you're in nursing school, you would need good support in terms of food, in terms of motivation, in terms of someone just cheering you up, in terms of even money. Because I wouldn't advise you being a full-time worker while being a nurse. I would advise you should probably work part-time, because we also need money. So I think you would need a good support system, and also you should be able to balance your school life and your outside life, because I wouldn't recommend you cutting off your activities or cutting out your personal life for nursing school. I just finished my LPN program, and there were times I went out, there were times I just had to take care of myself. So I wouldn't recommend you just shutting yourself out of the world just because you are a nursing student. That's why I talk about planning. So you need to plan everything. I'm a good procrastinator. I procrastinate a lot, and it affected me a little in nursing school, but thank God I was able to scale through my LPN program. So I think you should plan ahead, you should read ahead, because before you know it, it comes by so fast, and you'll be stuck with so many information, you'll be stuck with so many assignments, you'll be stuck with care plans to do. And trust me, you don't want to be in that situation, because I think nursing school comes with anxiety. I should say that you should know how to manage anxiety and stress, because it is stressful. Nursing school is stressful. So I would advise the things that works for you when you're anxious or when you're stressed, things to do when you're stressed. With me, I love eating, I love resting, and I love watching movies. Those things help me to relieve stress. I sleep, I eat, I rest, or I watch movies, or talk to loved ones on the phone. So you should know how to manage stress. Also, you should try to make friends, I mean good friends, and not friends that keep information. And please, if you're a nursing student, don't keep information from your friends. You don't want to be the only nurse. Are you the only one that wants to graduate? Trust me, you don't want to be the only one passing in your class. It's not going to make you feel good. It doesn't show you are intelligent. If you're making it, if you have a good reading technique, or you have materials that helps you, share with your friends, share with your nursing student, because I think you're gonna be more happy, you're gonna be happier, let me use that, you're gonna be happier when you graduate with your friends, and not you just sitting alone and your friends are like semesters behind you. That's not cool at all. So I would advise you, share your information with friends and make good friends, and ask questions. Ask your friends questions, ask your instructors questions. If you have any like what is it called, like a lab whereby you go and like a tutor, try and go there, ask whatever things you are skeptical about or you're not sure about, go and ask. And one thing I would say about this information is that you don't need all the information, you don't need all the textbook, you don't need all the videos, you don't have to go to YouTube to watch every single nursing videos online. They are going to confuse you because different videos, different nurses, and most of them are nurses, because I think some of the things that happens in the real world is a little bit different in school, because everything is based on what is on the textbook. So what you're saying might be right, might be correct, because some labs, like, okay, for example, potassium 3.5 to 5.0, but some hospitals can tell you, excuse me, 3.2 is okay, and probably 4.8 or 4.9 is okay. But you know, in school you're required to choose 3.5 to 5.0. So that is why I would advise be a little bit picky when it comes to videos online. And if your instructor recommend like some videos online to go watch, you can do that. But I don't think you should watch all the videos, read all the materials. Nursing school is expensive, textbooks are expensive, so you shouldn't buy every textbook someone talk about. Just try to know, try to figure out if you need this textbook, if it's going to work for you. Look through it, if it's something that's going to help you. Read reviews, read comments about other people, how it helped them, instead of buying like every textbook. And about passing the classes, I would say if you have a reading method that has been working for you all these years, I think you should stick with it. If I'm a visual person and you are an auditory person, like, these are like two different reading technique. So don't try to copy me, because probably I'm doing better and you want to copy me. It might not work for you, because we have different ways of learning. So if you have a particular way of learning, I would advise you stick with it. But after your first exam you failed, probably your second test you're not making it, I would advise you change it. Because if you know, if one method is not working for you, it's better to stick or to move to another method just to help you. And we know in nursing school, after you feel like 2 classes, you're going to be dropped out of the program, and we don't want to waste our time, we don't want to waste our efforts, our energy, our money, just to start nursing school all over again, or just to like fail nursing school. So if you know a reading technique is not working for you, I would advise you move to another reading technique and take a test and see how it works. And one thing I would also want to put in is your clinical classes should be your favorite, because that's where you get to see the disease process, everything you learned in class, like face to face. I think you should utilize your clinical classes, utilize your time doing your full head to toe assessments, because in lab in school probably you're not too comfortable doing with your fellow nursing students, or you're doing it on a mannequin. But having a real patient right in front of you, do it, like that is a good learning process. So I would advise for you to take your clinical classes seriously, make it fun. If you want to fail any class, it shouldn't be a clinical class. It should definitely not be a clinical class. So make your clinical classes your favorite, learn so many stuff, try as much as possible to practice. And if you have an opportunity during clinicals to go to other departments, I think you should go for it, because that's where you get to decide if you want to work in the emergency room, or you want to work in labor and delivery, or you want to work in surgery, you want to work in mental health. Go try as much as possible to explore during clinicals, because you are not going to get that time. Like I said, you studying ahead, planning ahead. Like I would always talk about planning. With nursing school, it's all about plan. Read ahead, do your assignments ahead, so you don't get filled with so many assignments. So if you know you're a kind of person that can't combine both schooling and having fun, I would advise you to just put a full stop on that, because you just imagine going to school for about 4 to 5 months. Just deprive yourself of all of those things. But you know, after you're done, you get the whole time. If it's summer break, you get like 3 months summer break to do whatever you want to do. But imagine you not paying attention, or you having fun instead of studying those 3 to 4 months, and you fail a class. You're gonna feel miserable. I've been there before, and it's not even fun at all. So I think if you need to deprive yourself from having fun or anything that will stop you from studying, if you need to deprive yourself from doing that, I would advise you do that for your education. Because if you're an associate degree, 2 years you are done, and you get to have all the fun, travel all the travel you want to. So I really hope this information helps. I tried as much as possible to put everything that helped me during nursing school, and hopefully it helps you. And once again, congratulations on deciding to be a nurse. Nursing is a rewarding career. We take care of people, we love people, we care and advocate for them. And I hope you're going to be a good nurse, a nurse that actually cares about the patients. Yes, we want the money. Also, we also want to take care of our patients, putting patients first, prioritizing patients. Try as much as possible to know who need our attention more. And one thing I'm gonna say with nursing school and the exams is for you to read the questions properly. Try as much as possible to understand what they are asking you to do before you choose an answer, because sometimes it can be very tricky. But if you pay more attention to details, I think you'll be very good. And then there are some good tutors online that are going to help you, some nice videos online that are going to help you. So thank you for sticking with me. It's been a pleasure. Thank you so much. It's Kami Bell. Please subscribe to my YouTube channel. Thank you. Bye bye. Thanks for watching. Please like, comment, share, and don't forget to subscribe. Thank you.